take the first step in taking control of their health. Joining me now is Dr. Ina Fishman and Dr. James Cox-Chapman to tell us more about this initiative. Welcome.
Good morning. Thank you.
Let's talk more about this Anthem Blue Cross Blue Shield Pro Health Initiative. What is this all about?
Sure. Well, we're really pleased to partner with ProHealth, which is one of the major employers in the state, because we think it's very important to invest in the health of not only our members, but in the community. And so we're trying to make sure that our members and Connecticut residents have the opportunity to be able to participate in programs that are going to help them stay healthy.
And I understand you were recently in Hamden?
I was. We had a health bus in Hamden, and that's where the Know Your Numbers comes from. We were hoping to get people to understand what their blood pressure was, their weight, their cholesterol, their blood sugar, so they could take the first step in taking care of themselves.
Let's talk about these numbers, Dr. Cox-Chapman. What's so important about these numbers?
Well, numbers are important. We're trying to communicate to our patients all the time the importance of knowing their numbers so they know where they stand and they know what they might need to improve if necessary. Another number we're looking at is exercise, because we think this is the key to good health, and this is the initiative that we're partnering with Anthem about. We have started a program for our employees to a walking challenge, a fitness challenge. We've had double the number of people sign up of our employees that we'd anticipated.
Because exercise is a major component in improving your health.
Absolutely.
Right.
It will maintain your health and wellness, and it certainly can benefit you in terms of lowering your blood pressure, lowering your blood sugar, lowering your bad cholesterol, and improving your good cholesterol.
Well, you also want to do this, I think, you want this the rest of the state to be able to take part in this initiative.
Well, absolutely. As a large medical group, we take care of 10% of the population of Connecticut. With this particular initiative, we're taking care of ourselves first so we can continue on our mission of taking care of patients.
Let's go through some of these numbers, because I know a lot of people get those numbers and are not quite sure exactly what they are looking at. Blood pressure, you have two numbers that you always look at. Could you explain what those are?
Sure. There are two numbers. The top number is called the systolic blood pressure, and that's the highest pressure in your system. And then the diastolic is the bottom number. And what we want to do is see those numbers to be less than 140/90. So if you see a number that's getting close, that means you're really heading towards high blood pressure or hypertension.
And that's not a good thing, right, Dr. Cox-Chapman?
That's correct. That's not a good thing. And there's been confusion about that number. Which one is more important?
Exactly.
They're both important. And so what to remember is you want that blood pressure less than 140/90. And if it's not, you should be talking to your doctor about it.
Now, can that be treated without medication?
It can be. Certainly some of the things that we talked about earlier. Diet is important, low salt, and exercise is really key. You can really control your blood pressure with exercise alone sometimes.
Another number we were talking about is the cholesterol number. All right, what do we need to look at there? I know it varies. I guess it depends really on your age and whether you're a male or female.
Well, those are components that you can't control, but there are actually three different kinds of cholesterols that we look at. The total cholesterol, the HDL is the good cholesterol. We actually want to see that as high as possible. And the LDL is the bad cholesterol, and we want to see that as low as possible.
And that's why we're all laughing, because it is sometimes confusing with these numbers. But if you know your cholesterol, particularly bad cholesterol, and try to work to keep it below a certain number, then that's going to be a very important step in preventing the development of heart disease.
And again, diet is also important here, as well as exercise.
Right.
Absolutely.
And with diet and exercise, even a 1% decrease in your cholesterol can reduce your risk of heart disease by 2%. So just think a 10% decrease reduces your risk by 20%, and that's dramatic.
I also know that a lot of people really need to get on medication to lower their cholesterol.
Well, that's another message I'd like people to know is sometimes your genetic makeup or you have a certain situation, medicine really is the right choice. Not in all the cases, but it's something not to shy away from if the message you're getting from your numbers is this needs to be corrected. You've done everything you could short of medications. There are excellent, low-cost medications with minimal side effects that can really resolve this problem for you.
So once you get those numbers, you really need to discuss this with your doctor.
Absolutely. That's really the key, because in Anthem we're trying to support that. We are not your doctor. But we would like to provide you with the tools that you need so that you can discuss these issues with your doctor and come up with a plan that's best for you.
What is it? Go ahead.
And at ProHealth, we are your doctor. And
Exactly.
we want to talk to you about it and engage you about it. And we want to do whatever we can to keep you healthy and to keep you from developing any of these diseases and to keep your risk factors as low as possible. That's the name of the game in maintaining your health.
And do you find that most patients follow the doctor's orders?
That's yes.
You do overall.
Although I don't really know because a lot of people make decisions when they leave our office and they get other information, but we want to keep in conversation with them. And I'd say the answer is yes over time, because our mission is to establish a long-term relationship with people as your primary care doctor, and over time to have you come to see that the advice we're giving is valid and sound and it's going to keep you healthy.
And for a lot of people, that's really the most important part, is to follow your doctor's prescriptions.
Right, and to stay healthy.
And there's the Anthem website for more information on this health initiative.